Experts highlight the need to protect against the rising influenza burden in India. West Bengal has recently reported a rapid surge in flu cases caused by H3N2 and H1N1 subtypes, and Kolkata alone is seeing a 6 to 7% positivity rate of the samples tested. Times to address the rise in influenza cases across India. Abbott hosted a roundtable in Kolkata on preventive measures to protect against infection. Kolkata, 19th April, 2023. India is currently witnessing a significant rise in influenza infection across the country. According to the Integrated Health Information Platform, India has seen a large number of cases of acute respiratory illness or influenza-like illness from January to March this year, amounting to nearly 1 million. Flu cases were also on the rise last year, with a roughly 16-fold increase in India from 2021. West Bengal alone saw a 5-fold increase in influenza cases reported in 2022 from 2021. Further, in 2023, West Bengal witnessed rising influenza infections. Kolkata alone is seeing a 6 to 7% positivity rate of the samples tested. As seasonal influenza poses a public health concern, it is important to take measures to address India's flu burden. With the aim to raise awareness about influenza prevention, global healthcare leader Abbott hosted a roundtable in Kolkata to educate people on how to protect themselves, their families, and the community against infection. At the roundtable, Dr. Raja Dhar, Director and Head of Department of Pulmonology, the Calcutta Medical Research Institute, said, "The flu cases have been rapidly rising in Kolkata this season. Between January and March 2023, we were seeing 2 to 3 influenza cases per week. Majority of infections this season are caused by the H3N2 subtype. It is extremely important for people to take preventive steps to not only safeguard themselves and stay healthy, but also protect the wider community. Influenza is a vaccine-preventable disease, and taking an annual flu shot based on the updated WHO recommendations on the currently circulating virus strain is a safe and effective public health measure that more people should adopt." Seasonal influenza, or the flu, is an acute respiratory infection caused by various types of influenza viruses, of which types A, including subtypes H1N1, H3N2 and more, and B cause the most cases during the flu season. When people are affected by the flu, they typically experience mild to severe symptoms, including fever, dry cough, sore throat, shortness of breath, fatigue, headache or body ache, and a runny nose. Infection can be transmitted from an infected person through the air when they talk, cough, or sneeze. As it spreads easily, individuals may be at risk of catching the flu from public settings, like schools or workplaces. People can take various steps to prevent the spread of influenza. These include frequent hand washing or using an alcohol-based hand sanitizer, covering one's nose and mouth when coughing or sneezing, avoiding touching one's nose, eyes, or mouth, and staying away from people showing symptoms. People who are unwell should also isolate to avoid spreading the infection. Additionally, as the flu is a vaccine-preventable disease, influenza vaccination is one of the most effective preventive strategies to maintain immunity for a long duration. Dr. Jajokar Kumar, Director, Medical Affairs, Abbott India said, "Most people think of the flu as similar to a common cold. But flu is different and is considered a public health concern that can lead to health complications. Due to low awareness about the seriousness of the flu and misconceptions about the vaccination, it is often overlooked. At Abbott, we are committed to helping people in India stay healthy. We champion the Mothers Against Influenza initiative, and we work with healthcare professionals and associations to ends."
The Director of Medical Affairs at Abbott India. Today we're going to talk about the flu burden or the influenza burden in the country. Over the last few months, we've seen the incidence of respiratory-related illnesses and influenza-like illnesses go up significantly in the country. Therefore, we feel that there is a need to create awareness awareness about influenza and the fact that it is a preventable disease when we look at it's a vaccine preventable disease, and there are other things that we can do to ensure that we don't have this flu burden in the country to this scale. So I'd like to start today's event with asking Dr. Rajadhar a few questions. Let me start by saying currently India is recording a high number of influenza cases nationwide. Can you please tell us a little bit about the flu impact on the population, the burden in India as well as in West Bengal specifically?
Thank you very much for that question. There's a lot of friends in the audience today. So everyone happy with me speaking just in English, or you want me to use languages other than English?
Bengali is comfortable.
English is comfortable for everyone?
No, Bengali.
Bengali is comfortable, so I'll
mix it up.
আমি বাংলা ইংরেজি হিন্দি মিলিয়ে বলবো। I sort of speak all three languages. So question asked is যে এবার আমাদের ইনফ্লুয়েঞ্জা বার্ডেন দেশে কিরকম, ইস্টার্ন ইন্ডিয়া কিরকম, নর্থ ইস্টে কিরকম। তো আমার কাছে কিছু আনঅফিশিয়াল ডেটা আছে which is NICET data. So this is data that's been given to by one of their senior scientists, আর এটা আপনি আমাকে কোট করে বলবেন as NICET data. So please acknowledge that it is NICET data, but also the fact that it's unpublished data কারণ ওরা এই ডেটা পাবলিশ করতে চায়। So just to give you a little bit of background, 2019 when we look at Bengal and the northeast of India, we had a very high number of cases of influenza. 2020 and 2021, the numbers came down, and it mainly came down because we were flooded by COVID at that time. So there was only COVID, and you have to understand something else which is important. আরেকটা জিনিস বোঝা জরুরি, সেটা হলো যে আমরা যখন নাম্বারস বাড়ে যে কোনো ভাইরাল ইনফেকশনে ইনক্লুডিং ইনফ্লুয়েঞ্জা, your tendency to test for it is greater. You would understand this. আমরা যেরকম এখন কোভিড এর জন্য খুব অল্পই টেস্ট করি, আর আমরা অল্প টেস্ট করি কারণ আমরা জানি যে এই সময় কোভিড এর প্রেভালেন্স স্পেশালি ইন আওয়ার পার্ট অফ দ্য কান্ট্রি ইজ লো। যেই টেস্টে পজিটিভ আসতে শুরু করবে, ধরুন 10টা টেস্ট পজিটিভ আসলো in a particular hospital, whichever hospital, you will find that the number of tests go up, and as the number of tests go up, the detection rates will also go up. So in 2020 and 21, there were very few tests. They were under in the state, in the state, there were actually less than 2,000 tests done for influenza in the entire state through 2020 and 21. Then 22 again, the number of tests went up, especially in the second half of the year. So starting from June onwards, the number of tests have gone up, and the tests have stayed up till about February, March, and is now going down again. So as far as percentages are concerned, at the moment, we are recording about a 6 to 7% positivity among samples that are being sent for testing. So 6 to 7% positivity in samples that are being sent for testing. Automatically the question would be, how many are we sending for testing? So if you look at Bengal, the number of tests requested in February, March, that is the last 2 years, was about 1,800. 1,800 tests being done. Out of those 1,800 tests, we had about a 12% positivity rate in Bengal. That's the NICET data, which is actually more than what we have in other years. 2019, for instance, we did about 12,000 tests in Bengal, about 12,000 tests. And out of that, the positivity rate was about 6%. Right? So, more tests, hence the absolute number is higher. If the percentage the percentage is lower. What about Northeast data? So, for the Northeast, the number of tests have actually matched that in Bengal. So, all the 7 sister states that we have together have done around 2,000 tests again this year between January and March. And again, the number of positive cases are about 7% in 2023. You can calculate the numbers from there. There's a lot of other viruses, and maybe we'll come back to that. But there's a lot of respiratory syncytial virus, RSV বলে একটা ভাইরাস হয়, যেটা আমরা বাচ্চাদের ক্ষেত্রে দেখে থাকি নরমালি। এটা এখন আমরা বড়দের দেখছি। And this is important because going forward, there might be actually a vaccine even for this disease. So we come to vaccines and their importance, but when we have a vaccine, we have a way forward in preventing diseases in the long term, and influenza is the biggest example in that category, and it is a vaccine preventable disease process.
Thank you, doctor. Another question is, what groups have you normally seen that are affected by the flu, or are certain groups that are higher risk of infection?
Sure. So I'm an adult pulmonologist, as people here know. I see only people who are mainly above the age of 12. So ideally I see people who are above the age of 18. But in this country, because the pediatric practice is still a lower age, I would see children even 12 and above. So for me, it's mainly the high-risk population. The high-risk population already porichoy ache. So the high-risk population are people who are elderly. Elderly globally is defined above the age of 65. Kintu amader deshe comorbidities সংখ্যা বেশি. Aging seems to be a little early. So for us, in our guideline, we have put a cutoff of 50, 50 বছর rather than 65 বছর. But globally, this number is 65. তাছাড়া high risk population full of people with diabetes, people with hypertension which is uncontrolled, heart disease, kidney disease, liver disease, all people who are on chronic medications for a background chronic problem which is to an extent uncontrolled would merit the terminology of being in the high risk category of disease. So high risk in the way of age, high risk in the way of population. Now the other category which I don't get to see is between 6 months of age and 5 years of age. একটা আমরা বললাম 65 বছর আবার আমরা নিচে বলছি 6 মাস থেকে নিয়ে 5 বছরের মধ্যে. So then the pediatricians see, and there also the incidence of influenza is very high. And there also prevention of influenza is an important thing to think about, but I'm sure we'll come to that soon.
Yes, actually that was my next question. What preventive measures can people take to protect themselves and the larger community against the flu infection?
Sure. So the biggest thing, like we have said already, and I guess a lot of the meeting today is to promote and make sure that people get vaccinated. Vaccination has received a big push with COVID. I think people are much more conscious now about getting vaccinated as compared to what they were before. And I think diseases which are vaccine preventable, influenza being a primary disease, they're right at the top, is important to speak about vaccination. So vaccination for influenza is important. The other things which are important in the prevention category are all things that we've done well during COVID. You know, things like masking, especially when you're in crowded places, especially when it's the high-risk population that we have talked about, crowded places at airports, flights, malls, cinema halls, stadiums. All of these places are crowded places, and if there's someone with an important comorbidity, and you all know that we are the diabetic capital of the world, so people with diabetes, which are not very well controlled, for instance, would want to do masking. Hand sanitization is easy. And all these respiratory viral illnesses, including influenza, including COVID, spread the same way as COVID does, which is aerosol generated. So if you hachlo, if you kashlo, a distance of 6 feet is where the aerosols would spread and transmit disease to others. So that's about transmission of disease. So if you go to hand sanitization, I mean, nake hat dilam, chokhe hat dilam, tarpor I sort of touch someone else, or I sneeze, so that would also be a way to transmit disease. That in a prevention and in a hand sanitization, which was so common during COVID times, is something which also needs to be thought about. Distancing in a country which has a population of 1.4 billion is difficult. So I think distancing is a challenge, but jikhane possible, jotota possible, is something we should do going forward, right? So I think these are important things. Barite, ma, baba, kaka, jatha, boyshko jara ache, tara high risk. তাই জন্য আপনার যদি সর্দি কাশি হয়, often we don't manage to test for influenza, but often the disease is influenza. আমরা numbers বলছিলাম a little while ago. So while the number of tests we said is 2,000, the number of reported people with influenza-like illness, the influenza-like illness মানে নাক থেকে জল পড়ছে, হাঁচি হচ্ছে, গলায় ব্যথা হচ্ছে, কাশি হচ্ছে, was 1 million in this period. So 1 million influenza-like illness, but the tests are as low as 2,000. So you understand that is for a variety of reasons, variety of problems, but influenza-like illness in a lot of cases is going to be influenza. So shekhane distancing from people who are high risk, who are elderly, who can get the disease, and if the disease happens, it could be severe, is something that people need to do on a regular basis.
So I want to ask you, how do people understand the difference between, say, a common cold and influenza?
They don't, and they shouldn't. So that's an important question. So প্রশ্নটা হলো যে কারো নাক থেকে জল পড়ছে, হাঁচি হচ্ছে, কাশি হচ্ছে, গলা ব্যথা হচ্ছে, তো বোঝার কি কোনো উপায় আছে যে তার ইনফ্লুয়েঞ্জা হয়েছে, না কোভিড হয়েছে, না কমন কোল্ড হয়েছে, which is due to a different virus called rhinovirus? So okay, so how do you understand? তো across the board এই সব অসুখে the symptoms are very very similar, and why you will hear যে গন্ধ চলে গেল বা টেস্ট চলে গেল ক্লাসিক্যালি কোভিডে হয়, it does not mean that an influenza or a rhinovirus common cold cannot have that symptom, right? তো এই স্বাদ চলে যাওয়া, গন্ধ চলে যাওয়া বা স্বাদ পাল্টে যাওয়া, গন্ধ চলে যাওয়া is something that can happen in any respiratory viral disease, but is more common in COVID. So the important thing is that you treat it like the most serious illness, which would be an influenza at the moment, or maybe 1 year ago would have been COVID. You do all the things needed, symptomatic treatment, supportive treatment, some amount of isolation, making sure you're well hydrated, all of these things, along with the treatment, যদি কোনো antiviral treatment থাকে, তাহলে সেই antiviral treatment in the right scenario, in the high risk population is what you do in these individuals.
So the WHO recommends an annual flu shot. Why is that, and what is the vaccine that changes every year?
Sure. So আবার আমি একটু কোভিড নিয়ে বলছি, কারণ এখন সবাই কোভিডের কথা ভাবে, কোভিডের কথা ভালো বোঝে। So COVID started off, if you remember, with the alpha strain, and today we are on a strain which I cannot remember, but it's that XBB 1.16. That's the subvariant of Omicron that we have today. So influenza similarly undergoes mutation every year. And in the influenza strain তাতে দু ধরনের, তো there are 4 categories of influenza: A, B, C and D. So A, B, C and D. আমরা সবচেয়ে বেশি চিন্তিত about influenza A. Influenza B also happens in significant numbers. Influenza C often causes very mild illness. Influenza D normally does not happen in humans, it happens in cattle. ঠিক, তো ইনফ্লুয়েঞ্জা A অনেক সংখ্যায় হয়, ইনফ্লুয়েঞ্জা B স্পেশালি আমাদের দেশেও অনেক সংখ্যায় হয়, large numbers. Influenza C very mild disease, probably not worth worrying about, and influenza D normally does not happen in humans, it happens in animal livestock like cattle. But influenza A, there are 2 parts, there are 2 different antigens which are important. One is related to blood, আর তাই জন্য হিম থেকে সেটাকে H দিয়ে describe করা, H, হিম which is blood, which is H. The other is N, which is neuraminidase, which is a nerve antigen. So যখনই আপনারা দেখবেন ইনফ্লুয়েঞ্জা description হয়, it is described as an H with a number and an N with a number. So H with a number like H1N1, right? You know about H1N1, like H3N2, which is the prevalent influenza strain in this city and in the northeast at the moment. Even though with the summer the numbers are coming down and will come down even further. So whenever you see influenza, you think about influenza A, you think about influenza B. In influenza A, the various types you have is an H and an N, H1N1, H3N2 as an example আমরা বুঝি। তো প্রত্যেক বছরে H আর N টা পাল্টে যায়। So sometimes you would have an H1N1, sometimes you would have an H3N2, sometimes you would have an H3N3, sometimes you would have an H5N5 and so on and so forth. তো তাই জন্য প্রত্যেকবার যখন ভ্যাকসিন তৈরি হয়, প্রত্যেক বছর যখন ভ্যাকসিন তৈরি করা হয়, তখন the aim is to cover the influenza A and the influenza B category. So you cover influenza A and you cover influenza B and you have a vaccine which covers both. তো এখানে দুটো অ্যান্টিজেন বললাম, B ও similarly দুটো অ্যান্টিজেন থাকে। So you have all these 4 antigens that need to be covered ideally. So that's 4 antigens to be covered with the vaccine to give protection against both influenza A and influenza B, which happen variably across the country. Okay? অনেক সময় এই ইনফ্লুয়েঞ্জা স্ট্রেন বছরে চেঞ্জ হয়ে যায়। যেরকম for instance, when I was seeing patients in August, September, I was seeing quite a lot of H1N1. Now when I see influenza patients, I see mainly people with H3N2. So you need to have vaccines which cover these. Different strains also need to be covered. So তাই জন্য প্রত্যেক বছর the World Health Organization sits together and decides on which vaccine needs to be for that particular year. And normally the vaccines are different for the northern and the southern hemisphere. The northern hemisphere এর জন্য একটা ভ্যাকসিন, southern hemisphere এর জন্য একটা ভ্যাকসিন, which gives you coverage. আমাদের দেশটা interestingly seems to fall more in the southern rather than the northern hemisphere. আমাদের দেশে আরো কমপ্লিকেশন আছে যে উত্তর দিকে আর দক্ষিণ দিকে, north and south, the strains that we have and the times when we have it seem very different. তো কোনো সময় বর্ষাকালের শুরুতে বেশি হয়, কোনো জায়গায় শীতকালের শুরুতে বেশি হয়. You know, so the times are also very, very different. So the vaccines need to be tailored to the time of the year when it needs to be given, and every year you have a different vaccine. The constituents are different because the strain of influenza for that particular year, the A and the B, would be different. আমি কি বোঝাতে পারলাম? আপনারা কি বুঝতে পেরেছেন? Did that make sense? Okay.
Just one more question, Dr. Dhar. You know, we get a lot of questions asking us, does the COVID vaccine cover influenza and vice versa? So there's a lot of confusion amongst our patients. Can you just
Sure.
elaborate on that?
Sure. So, এটা মানে এই প্রশ্নটা অনেকটা হলো যে জ্বর ম্যালেরিয়াতেও হয়, ডেঙ্গিতেও হয়, রাইট? তো আমরা যদি ম্যালেরিয়ার ওষুধ খাই তাহলে কি ডেঙ্গি সেরে যাবে? সেটা সারবে না, বিকজ যে জীবাণুটা it is completely different. So the same for COVID and influenza. While COVID and influenza can happen very rarely in the same individual, the drugs that are given, the vaccines that are given are all going to be different because they are completely different viruses which cause these two diseases. So similarity একটাই যে কিছু ক্ষেত্রে যেখানে mild disease সেখানে symptoms are very similar to each other. However, the virus is different, and because the virus is different, giving the same drug or giving the same vaccine will never cross cover between each other.
Thank you, Doctor. Can I just ask Dr. Jijo a couple of questions? Thank you so much. Dr. Jijo, can you tell us a little bit about the barriers that you see for vaccinations in India?
Thank you very much. First of all, very good afternoon to each one of you. I'd like to thank each one to take the time out here and being a part of this entire journey to increase awareness about influenza. Just to tell you, I can speak only in English. I don't know to speak in the Bengali language. Just to emphasize on a particular point, there is, after the talk of Dr. Rajadhar, it is very clear that there is evidence that in a high-risk population, what Dr. alluded to, typically the elderly population, more than 65 years of age, patients with diabetes mellitus, patients with a cardiovascular disease, like patients with hypertension or myocardial infarction, patients with renal disorders, or patients with respiratory disorders like asthma and COPD. If these patients are vaccinated, there's a 50% less chance of hospitalization if they are infected with influenza. And that's the reason this high-risk population is very important that they need to be vaccinated. Similarly, if I look at the pediatric age population, children less than 5 years of age, if they are vaccinated, there's a 57% less chance of hospitalization if they get infected with influenza. And the most important population, that is a pregnant woman, if they are vaccinated, there's 20 to 30% less risk of preterm birth if they're infected with influenza. As you understand, preterm birth is a birth of a baby before the term of the gestation. So all this evidence clearly suggests that if these people are vaccinated, all this influenza-related complications and hospitalizations can be avoided. Now coming to the barriers about why, although we know about this particular disease, we know about the prevalence, which Dr. Rajadhar clearly alluded to, we know about the prevention by vaccination, still there are big barriers. What are those barriers? One of the barriers what we see out here is that influenza or flu is still being considered as a common cold. It is something which will just come and go. But the fact is, influenza or flu is caused by a specific type of virus which is called as the H3N2 or the H1N1. If I take globally or if I take in India, it is a major public health problem for the simple reason influenza can be a serious respiratory disorder which can lead to complications and can lead to hospitalization. The second barrier, what we clearly see out there is that there's a limited knowledge about awareness of vaccination amongst the doctors as well as in the patients. If I take the high-risk population, even today, like I spoke about, patients with diabetes, patients with hypertension, myocardial infarction, asthma, COPD or renal disease, the focus out here by the doctor or the patient is still on the treatment. But when it comes to prevention, there's not much to be done out here. This whole concept of adult immunization means an adult taking a vaccination to prevent a disease is quite new out here in India. It's still in the nascent stage. The third important point when it comes to barrier is about vaccine hesitancy. Now, this is a new word which actually been coined by the World Health Organization, and they clearly suggested, as you understand the word, vaccine hesitancy means they are hesitant to take the vaccine. Now, this vaccine hesitancy, which is a perception of a particular person, it is actually one of the top 10 global threat, and it has been taken up as a very negative outcome. Now, vaccine hesitancy can be related to concern about the safety of the vaccine. It could be cultural issues or trust issues. So all these being the barriers about this particular disease and vaccination, we are out here with an objective to raise awareness about this particular disease. This disease, the complications and hospitalizations can be prevented by a simple annual influenza vaccination. And together, we all can change this mindset that prevention is better than cure.
Thank you, Dr. Jijo. Can you very quickly just tell us what Abbott is doing in the field of influenza awareness and why we are so involved in it?
So, Abbott, our purpose is very clear. We are constantly working to help people live life to the fullest. So, when it comes to awareness, Abbott does multiple scientific exchange meetings where we raise this topic about awareness, role of vaccination, and these meetings are done directly with the doctors or in collaboration with medical societies. Secondly, we also started a campaign way back in 2017 called as MAI, M-A-I, that is Mothers Against Influenza, where we educate pregnant women about the need about this particular disease of influenza and the need of vaccination. We also tap into the media, like the way we are doing out here, whether the print or the radio, also the social media, Instagram and the Facebook, to spread awareness of this particular disease. One more perspective what we are doing out here from an awareness is about school-going children. So at the beginning of the academic year, somewhere in the month of June, we go to various schools, we educate the parents that their child needs to be vaccinated so they can protect themselves from this particular disease and its complications. So this is a journey which we all have begun, and it's a continuous phenomenon for all of us to ensure that the high-risk population and this vaccine preventable disease is being addressed in the right manner.
Thank you, Dr. Jijo. Before we open the floor for questions, Dr. Dhar, are there any other...
I was just going to ask something, so I can ask the audience because I know this audience well. So, এখানে যতজন রয়েছেন তাদের মধ্যে how many people have yourself or a family member vaccinated for influenza? কতজন আছে এখানে যাদের নিজেরা বা বাড়িতে যে কেউ ইনফ্লুয়েঞ্জা ভ্যাকসিন, বাবা মা কাকা জ্যাঠা কারোর ইনফ্লুয়েঞ্জা ভ্যাকসিন হয়েছে? I can see one hand. You see, so I have been, so I will put my hand up. আমার মা vaccinated, I am not, but that is because I have not reached the age, neither do I have a comorbidity. So, but my mother is vaccinated. So you see, this is something easy. You heard the numbers. Jijo very beautifully gave you the numbers. So 50%, 57%, all of you understand that, but just to understand the impact, যে দুজন যদি hospitalized হতো with flu, তার মধ্যে একজন হবে না if you take the vaccine. Be that in the pediatric age group or be that in the adult age group, that's the sort of percentage we're looking at, 1 out of 2. So that's an easy intervention. It's not a very expensive intervention. A hospitalization, all of you know how much that costs in this country. So why would we actually not do something as easy as that for your own family, whom I'm sure you love more than anything else in the world? So that's the impact. So be conscious. It starts at home. Jijo said something very, very important just now. You know, he said doctors. The doctors are not conscious about influenza. It is like a doctor smoking. So suppose I smoked and I said, I'm a lung doctor, you have to stop smoking. The conviction with which I will say, please stop smoking if I smoke myself would be far lower if compared to that I had either quit smoking or I have never smoked. Similarly, if all of you get vaccinated or get your family vaccinated on a regular basis the way it should be done, then going forward, when you reach out to people and all of you have that reach, you would have far greater conviction in convincing people all around that they need to be vaccinated. So it should start, charity should start at home in mind.
Thank you so much. Anyone has any questions? Yes, please.
একটু পাশাপাশি আসলে ভালো হয়।
পাশাপাশি
এখানে ওইখানটা আপনি যেখানে আছেন
আচ্ছা এখানে বসবো আছি ঠিক শিওর আমি আসলে বসতে খুব ভালো
You can ask the question.
Okay.
That's okay.
It's a very common question nowadays, but though I would like to ask you these questions, there is a huge discussion that the side effects of vaccines. So can you give us some medical trial data or something which can substantiate that there is no side effects of
I'll give you the data. So you know, am I okay to stand up and say? Is that okay? So you know this vaccine hesitancy that Jijo spoke about a little bit while ago actually stems from the fear that the vaccine would have an adverse effect. You understand that? That's why vaccine phobia, vaccine hesitancy, these terms have come into being. And a lot of it have been reports of clots in the lung, for instance, in people who have been COVID vaccinated with a certain brand of vaccine, and we won't go into the brand. But it's been reported across brands. Now put this into perspective. If you think about the number of people who die with clots in the lung globally, it's about 1 in 150,000 people who die from a clot in the lung. Right? It's a cause related to vaccination. Any clot in the lung, someone dying with a clot in the lung is 1 in 150,000. If you think about the number of people who die from a clot from being vaccinated with a COVID vaccine, the number is 1 followed by 10 zeros after it. I'm not sure how much that is, but it's a very large number. I'm quoting this data because I have read it up because I knew someone will ask me this question. Right? So you're talking about a very, very rare instance. Rare instances always get reported by media throughout the world. A rare event, someone dying, someone falling off the 50th floor of a building and dying, will get reported. The fact that no one fell off the 50th floor ever in the last 50 years will never get reported because all those people have remained well. So what is deemed as newsworthy are stray events that happen once in a blue moon. Unfortunately, if you add these up, they come to a number which is double digit. 10, 20, 50. You know how many vaccines from COVID this country has had in the last 2.5 years. Right? The number of reported events are still in double digits. So, a lomba gorgota bolla with a little bit of data simply to say that what gets highlighted is the adverse effect of any intervention, be that a vaccine or a drug, what does not get highlighted is the positive effects, the benefit which a large majority of people have from that particular vaccine. Suppose I went out of this building today and my car crashed, it will definitely get printed. However, I go home safely every day and I have done that for the past 12 years after I came back to this country is never newsworthy. And understandably, so I'm not saying that newspaper is chapa uchi, but it's understandable. So you understand it's stray events that get reported and it's stray events and the conviction that the vaccine is safe is something which comes from the literature and also my own experience and other doctors like me who share my experience.
Yes.
First of all, Shubh Navabarsho to all of you.
Thank you.
Dada, the question is, India is a heterogeneous environment, and you have up snow-capped mountains, down south to hot Chennai, and a vaccine performing from -40 to +40 environments. What is expected that efficacy will work everywhere, or you have a different variant for the up north and south?
Another very good question. I mentioned this very briefly in passing. So there are two different times when the incidence of influenza is high. It is high at the onset of the winter season in the NCR region, the northern parts of the country. It is high in the southern parts of the country at the beginning of the rainy season. So those are two different times when the vaccine can be given, should be given. The other question about temperatures, there is a storage directive that is there with the vaccine, right? I can quote it, but it's not important, it is there on the package. So whichever vaccine you buy will always say how it needs to be stored. And it needs to be administered when it's been taken out from that temperature and given to the individual. So the outside ambient temperature, the fact that it's 42 degrees today, does not really make a change to the vaccine state because it's been stored the way it should be stored, right? The other important thing is, there's a part of the country which behaves like the southern hemisphere. There's a part of the vaccine that behaves like the northern hemisphere in this country. However, we don't have, or we have access to both the vaccines in this country. We have the southern hemisphere and the northern hemisphere vaccine which are available. There's a lot of intermingling. Amader deshi joto travel hoy between north, south, east, west is huge. So at the end of the day, I don't think it matters a lot which vaccine you take as long as you take a vaccine. But we have to take a vaccine for sure. And if you take the southern hemisphere versus northern hemisphere sensibilities in, there might be a slightly greater efficacy of doing that. But frankly speaking, when I administer the vaccine, I don't really think about whether it's the southern hemisphere or the northern hemisphere vaccine I need to give. I just ensure my patient has the vaccine.
And another question is, people are only ready to take vaccine when they are very much scared about that virus. And what are the implications of having influenza, and what could be, apart from the comorbidity, what is the chances that people are affected with the measure?
The comorbidity is not the disease. You see what I mean? So it is people with comorbidities who get bad viral pneumonias, including influenza and then maybe a secondary infection or a viral pneumonia in that population of patients. So viral pneumonias behave very much like the severe COVID pneumonias, right? So you get a large pneumonia, you get a reaction in the lung which is called ARDS, your oxygen levels drop, you need respiratory support, you end up in intensive care unit, etc. And there is a small mortality attached to it, like there is for other respiratory viral illnesses. So I think it's important to ensure. So you take the paradox of children. So children have a national immunization program. You will never see the media or the doctors or us combined having to chase children to give their vaccine. Their parents will automatically take them and take the vaccine. So there's no vaccine hesitancy here. So there's a parallel system where people understand they should take the vaccine and they give their children the vaccine. So we need to get to a similar scenario in our population, not necessarily by scaring them, but showing them that people who got the vaccine are doing better and their parents could do the same. And I think the COVID analogy is very important here. Very, very important that a disease like this in the environment of a pandemic could be overcome by vaccinating about 90 crore people over a period of 2.5 years. So that analogy.
What is the difference between adenovirus and the normal?
question
I have a very basic question. When we talk about influenza or flu-like diseases, H1N1, H3N2, influenza A or H3N2, H1N1, adenovirus আমরা recently দেখেছি. So if you can give us an idea कि कौन-कौन ভাইরাসের থেকে protectionের জন্য we have vaccines and what are the availability of it? Like for instance, we know that influenza vaccines are widely available. Pneumonia is a bacteria, but the vaccines are widely available. But what about the other vaccines?
So the other one that we haven't spoken about or you haven't mentioned is COVID. So that is still reasonably available. How much we should take it, I think, is a debate that the entire world is doing just now. If you have not taken 3 shots, then you should definitely do it. But about the 4th shot, there is debate, and I think my recommendation, if I ask you, but I'll still say, is that if you are in the high-risk category, or if you are a healthcare worker, or if you are people like yourselves who meet a lot of public, who travel a lot, you should probably take a 4th dose of the vaccine too.
But there is also one more question, right? That whatever vaccines we are getting in India for COVID are for the same strain in 2020. That has not been
That's what I said. So that is why there is a debate. If we had a strain which could cover the Omicron and the subvariants in 2023, there would be no debate.
Exactly.
So you understand that having a variant does not mean that you would have zero immunity with the vaccine. It means you would have a lesser immunity to the vaccine. Right? So suppose, for instance, when you had Delta and you had the vaccine, the coverage was say 70%. Today that coverage against the Omicron variant might be about 50%. But that's still a better number than zero. Right? So you compare that, weigh the risks, and then take the fourth dose as required. It is just that the government has not mandated a fourth dose as yet because the numbers have been very low today.
And what about other viruses? Like
So other viruses we will have, they will come, but we don't have, so I'm not speaking about them because they're still to come. But over the next 2 years, you will hear about other respiratory viral illnesses also being prevented by vaccines that are freely available in our country.
অ্যাডিনোভাইরাস বা রাইনোভাইরাসের তো এখনো কোনো রকম ভ্যাকসিন কিছুই এরকম নেই।
না, এখন অব্দি নেই, অ্যাডেনোরও নেই, আরএসপিরও নেই, ওগুলোর কথাই বলছিলাম যেগুলো আমাদের হবে খুব শিগগির। বাট ওয়াচ দিস স্পেস।
Normal influenza. What is the difference?
আপনার একটা প্রশ্ন ছিল সেটা
What
বলুন।
is the difference between the adeno and normal influenza?
What is the difference? Normal influenza not. So adeno is a different virus. COVID is a different virus. Respiratory syncytial virus is a different virus.
The symptom is same.
The symptoms are similar and the route of transmission is similar. You see, so aerosol route, inhaled route, আমাদের হাতের মধ্যে fomites দিয়ে spread করতে পারে. So the routes are similar, the symptoms are similar, but the viruses are completely different. They belong to various different families of viruses. So there's no cross coverage with vaccination, is what I'm trying to say.
Yes, ma'am.
রাজাদা, আমরা দেখছি যে পোস্ট কোভিড মানে কোভিডের পরে প্রায় বাচ্চারা আজকাল খুবই ভুগছে। অ্যাজ আ মাদার আমি কি করে এই মুহূর্তে আমার বাচ্চার মানে ধরুন গলা ব্যথা হলো, সর্দি কাশি হলো, পেট খারাপ হলো, তো এই অবস্থায় তার কি ধরনের যত্ন নিতে পারি বা কি ফুড তাকে আমি দিতে পারি?
Sure. So I think that's a valid question. You have a son, right? ছেলে, right?
মেয়ে,
correct. So you have a daughter. Others have a similar problem. But it's a similar problem with elderly. It's a similar problem even with people like us who deals with disease. So I'm not saying this for sympathy. I'm just saying this as an example. যে আমার গত 12-14 মাসে সর্দি কাশি পার্মানেন্টলি ঠিক হয়ে গেছে এরকম প্রায় হয়নি। Every few days I get a bit of a fever, I get a scratchy throat, I take a paracetamol and then go to work and things get better. But so that aside, I think you need to give them a nutritious diet. You need to make sure that they're vaccinated. বাচ্চাদের বলা isolation, hand sanitization, masking is probably next to impossible. So তাই জন্য it's a question of keeping an eye on them, making sure that if they spike a high fever or if they have a bad cough, if God forbid their oxygen levels drop, then you access the doctor as quickly as possible. But aside from that, এই যে আমরা hand sanitization, masking, social distancing, এই SMS বলি আমরা, সেটা বাচ্চাদের ক্ষেত্রে যারা স্কুলে যাচ্ছে বিশেষ করে তাদের ক্ষেত্রে করা প্রায় অসম্ভব ব্যাপার। It's almost next to impossible. And you would have to tie your children in chains and that would create a mental problem rather than the physical problem.
আচ্ছা, এই সময় বাচ্চাদের গরম জলে স্নান করানো উচিত না ঠান্ডা জলে স্নান?
আমি তোমায় বলি তো, আমাদের দেশে একটা স্টাডি হয়েছিল লিটল while ago when we looked at triggers of airways disease, asthma etc. trigger, what is special to India. তো আমি আমার পেশেন্টদেরকে অনেক সময় বলি যে ঠান্ডা গরম অ্যাভয়েড করো, একটু ঈষদুষ্ণ গরম জলে চান করো। So the reason we say that is the viruses seem to replicate better when they get a cold temperature or when then a sun changes the temperature. Chilled drinks seem to be a trigger for airway narrow. So তাই জন্য ঠান্ডা অ্যাভয়েড করা, chilled drinks অ্যাভয়েড করা, সর্দি গরমি ঠান্ডা গরম অ্যাভয়েড করা are things we tell from that perspective. The virus replication seems to be greater in the cold and the fact that you seem to have more of airway spasm when there is change of temperature and when you take chilled drinks. So তাই জন্য এই কনসেপ্ট about avoiding this.
দাদা এফিসিয়েন্সি রেট কিরকম?
কিসের রেট?
এফিসিয়েন্সি রেটটা
ইনফ্লুয়েঞ্জা রেট কমছে গো। তো till about March we had significant numbers of H3N2. Significant numbers. When I say significant numbers, আমি আমার personal experience থেকে বলছি, I would see about 2 to 3 cases in a week. And you understand যে এটা যারা অসুস্থ, আমি তো বাকিদের ইনফ্লুয়েঞ্জা টেস্ট করাই না, I only do it in people who get admitted to me and are unwell. So these are people who also seem to have a bacterial superinfection. If you look at the entire population, joto loker test hocche, which is about 5 to 6% of the people who have the symptoms, তাদের মধ্যে positivity rate is about 1 in 10. So joto loker test hocche is a small number. Tar 10% is the positivity rate for influenza at that time. এখন the numbers, at least in my experience, I don't have official numbers for this, but আমার experience, I have not seen a positive test for influenza in April 2020. এখনো দেখি। So I think with the heat, the numbers are coming.
আর ফ্লু ভ্যাকসিনের এফিশিয়েন্সি রেট কি রকম আছে, মানে কি রকম এফিশিয়েন্সি রেট?
So somewhere between 50 to 60%, right? That's what
would like to comment on that.
So efficacy rate is almost up to 80%.
80%.
No, just a point which was I just heard about this. What about this virus diseases vaccination? When you're going and speaking across the country, adult immunization as a concept is still new. We spoke about high-risk population. We spoke about elderly population more than 65 years of age. Patients with diabetes, heart disease like uncontrolled hypertension, myocardial infarction, patients with asthma and COPD, chronic kidney disease. People getting vaccinated, they are still not aware. I mean, it's very important that we all need to be together to change this mindset. High-risk group population have to be vaccinated. At least we can safeguard from one particular disease which is pertaining in our country year on year. So the whole concept of adult immunization can only move if the entire industry, doctors, medical societies, and the media come together and work unanimously for this vaccine preventable disease.
Absolutely, couldn't agree more.
Thank you. Any other questions?
No.